Now, as we heard there, the Omicron variant is putting pressure on hospitals. That includes intensive care units and nurses in particular. Well, they are bearing the brunt of sick calls and staffing shortages. So to talk about this, we're now reaching out to Heidi Janson. She's an ICU nurse in Toronto. Heidi, thank you for joining us today.
Hi, Michael. Thanks for having me on.
Now, as we said, we are very interested to hear your perspective. And yesterday, Ontario did report a record high number of hospitalizations. I'm wondering, what does that actually look like? Can you describe what it's like in hospitals like yours when numbers are this high?
Oh, it's a lot. I work in a Toronto area hospital. I'm a critical care nurse. The patients just keep coming. They are sicker and sicker than they have ever been. We see people who have delayed or paused their care, their treatments, their surgeries have been delayed, and they're just sicker than they used to be. They have chronic conditions like cancer and diabetes and heart disease, and they are still sick and they need to come for care as well. We also care for people who are critically ill with COVID, and they have high needs. They need to come to the hospital, but they're overwhelmingly unvaccinated. What I keep seeing at the bedside is that vaccinations work and they keep people out of ICU.
Build on that point. Vaccinations, you say, work. Compare a patient who comes in who is vaccinated versus what you're seeing in patients who do not have a shot of the vaccine.
One shot isn't enough, but on the whole, I just don't see the people who have 2 or 3 vaccines in my ICU. I only work in ICU. So yes, there are some people who are admitted to the regular wards who are partially vaccinated or fully vaccinated and maybe immunosuppressed. There's the edge cases. But in the ICU, on the most seriously sick, critically ill patients who are on multiple forms of life support, who keep dying, who we fight for every single day, and we just can't save, those people tend to be unvaccinated.
Mm-hmm. And as you said right off top, the staffing is very pressed right now. Stress levels are high, and we know this is leading to staff burnout. I'm wondering how you have seen that manifest itself with you and your colleagues. We're now nearly 2 years into this pandemic. How has all of this affected you and the people with whom you work?
It's a constant source of stress. Every shift, we want to be ready. At every moment, we want to be ready to admit the next person who needs to come. If you have your heart stop somewhere in the hospital, we want to bring you to the ICU right away, as quick as we can, immediately. And so we always need to have a plan. When we have 1 or 2 or 3 sick calls in a shift, it makes it very hard to plan for the next admission because we're constantly trying to shuffle patients so they can have as much nursing time and care and the safest possible place that they can be.
Now, after sorry, go ahead.
In my personal case, I've been an ICU full-time for about 7 years. The last 2, I have been full-time through the pandemic, picking up overtime when I can. And burnout has affected me quite close to home. In November and December, I made the decision that for my own mental health, I had to take a step back. So I have gone to part-time. I'm now working fewer hours, and that affects staffing just the same way. I want to be there for my team, for my patients, but for my own mental health, I can't. And I'm not the only one.
Mm-hmm. And this is not just a job that's 9 to 5 and you walk away and don't think about what happened at work. I can imagine that you're haunted by everything that you've already seen, again, in these nearly 2 years of this pandemic.
Yep. You've said it. I don't have a lot to add to that. It stays with you.
What images go through your mind when you bring your work home?
It's less about an image and more about a lingering irritability. It's just everything is tense and tight and snappy, grumpy maybe. The images of the people leaning over a bed, holding an iPad on a strange angle so that this person can see their family, and even if their family can see them, even if they are so sick and so sedated that they can't interact, that they're in a medically induced coma. There was one patient I had who, because they had COVID and they were dying, and I couldn't let the family into the room for a risk that they would also get sick. So I turned the bed and pulled the bed as close to the door as I could so they could at least see the patient's face. But saying goodbye through a doorway is brutal.
I appreciate that. You know, after so many months on the front lines of this pandemic, I wonder, Heidi, from your perspective, what do you think might have been done differently? Could anything have been done differently to improve the current situation?
I'm not a public health expert, but one of the things that I think that the Ontario government needs to do going forward is to open up testing to children under 5 and daycare and home-based and institutional daycare workers. The children under 5 are the only group remaining in the province that are ineligible to be vaccinated at this time. They are also children. They touch each other. They can't social distance. They play. They share germs. I think testing and high-quality masks for daycare workers and testing for children under the age of 5 is really important.
Heidi, I appreciate the time and I appreciate the work that you do. Thank you for this.
Thanks for the opportunity, Michael.
And that's Heidi Janson, an ICU nurse in Toronto.